Blessed day to all. Welcome to our study in this criminology field. This is Mr. Paul Jana Mazores, and today I'll be discussing to you under the lie detection techniques of the BS Criminology program, the known methods of deception detection. To begin with, let's start with identifying what are the known techniques in deception detection. First, we have the ancient method. Second, we have the observation method. The third, we have the hypnotism. Fourth, we have the word association test. The fifth, we have the hypnosis and narcoanalysis, or what we commonly known as the truth serum. Six is the intoxication. Seven is the psychological stress evaluation. Eight is the brainwave fingerprinting. And we have the ninth, which is the polygraph examination technique. Let's have them, the overview on how they conduct it one by one. First, let's have the ancient method. Historically, early human beings have their own way of determining lying or the guilt on the part of the accused and the accuser. Their common method is through the application of the ordeal. Ordeal, here we conduct it by giving severe tests of character or endurance. In the medieval time, judicial trials in which the accused was subjected to physical tests, carrying or walking over the burning object, or immersing the hands in scalding water, and the result being considered a divine judgment of guilt or innocence. Usually, if the hands of the accused is not hurt, he is innocent, while if the hands of the accused submerged in scalding water or the foot of the accused who walked in the burning object is hurt, that proves the guilt during that time by using ordeal. Second, we have the observation method. Here we are looking into the facial expression of the subject while he is under interrogation or questioning, such as the blushing, paling, or profuse sweating of forehead are sign of detection or deception. Dilation of the eyes, protrusion of eyeballs, and elevation of the upper eyelids. Next, the squinting of the eyes that shows the envy, disdain, or distrust, and etc. by the subject toward the interrogator. The twitching of the lips, excessive winking of the eyes, the failure to look in the inquirer straight into the eyes because eye contact can show something. Excessive activity of Adam's apple and the vein of the temple due to the dryness of the throat. That shows that the subject is tense. There is pressure on him or her. Quivering of nose or nostrils. A peculiar monotone of the voice. A forced laugh. Rolling of the eyeballs one direction to the other. Next, we will look into the postural reaction of the subject under interrogation. And these are as follows: fidgeting, tapping, drumming of fingers on the chair or other surfaces, swinging of legs or of one leg over the other, unnecessary movement of the hands and feet like scratching, nail biting, thumb or finger sucking, etc. Pulsation of the carotid artery in the neck, incoherent trembling and sweating of the whole body. Next, we will see through the cause and effect processes. we have the stimulus reaction test. Here, the reaction time or the response time refers to the amount of time that takes place between when we perceive something to when we respond to it. So if there are delays, it means the subject is thinking or making up some stories so that he can avoid the answering the truth. It is the ability to detect, process, and respond to stimuli. So the response time, it matters in this portion. Next is the stimulus response test. We give example here, example of stimuli and the response. Of course, if you're hungry, so you eat some food. A rabbit gets scared, so it runs. You are cold, so you put on jacket. So if you ask a question, especially the relevant one, you look how the subject will respond to it, and that shows something. Let's move to the third one, the hypnotism. Hypnotism is based on the animal magnetism, wherein we want to put the subject into a state of mind, but wherein it was first used by Franz Friedrich Anton Mesmer, which is anchored in the principle of the electromagnetism, and that was first used for therapeutic effect influence to other persons. Here, the subject will be instructed to sit quietly and gaze at a flashing light or some kind of shining object dangled before his eyes, so that he will cooperate with whatever the hypnotist would like him to do. By that, the subject can recover some memory, and those memories are will be asked by the interrogator so that they can check if it has relevance to the case or some the information that can help or lead into detecting some deception or that can give information relevant in solving a case. The subject here is not actually sleep, but there is a complete comfortable state of relaxation. By that, he can cooperate with whatever the hypnotist will tell him to do, or he will just answer what the hypnotist will ask. And we have the fourth one, the word association test by Sir Francis Galton. This type of deception detection is being done by giving the subject long list of carefully selected stimulus words and other pictures wherein there are also interspersed some other irrelevant words. The point here, the list has something to do with the case. It has relationship to the facts of the case, so that it is being done when the list of the questions or list of the words or some pictures is shown to the subject will just respond to the very first word that may come to the subject's mind. By that, the response of the subject will be examined by the interrogator if it has relationship or association to the case, so that we can check also if the subject is deceiving or he is cooperative. Dr. Jung was able to observe how the thinking reaction were linked into the emotional habit of his subject. Because behind this method, one word or idea is just reflective of another word or idea. And by that, we can see by their expression, their association that forms the meaningful picture. The fifth one is commonly called as truth serum or the narco-hypnosis or narco-analysis. It is being done by intravenous injection or there are oral medicine given to the subject. These are various drugs such as hyoscine bromide, morphine, ether, chloroform, sodium amytal, and scopolamine. This produced the condition of anesthesia. Under the truth serum, there must be immediate need for a physician present during the test because they are the one to administer the drugs to the subject. And of course, they need the proper determination to produce the required result. Next, what the investigator desire is to give the appropriate dosage so that the subject will be put into the house receptive stage or the twilight zone. The subject will be in a half sleep condition wherein the stored content of the mind called memory can be recovered. Now, the subject will answer by experiencing temporary removal of his willpower, self-preservation instinct, and the reasoning power. Because if the subject is not in the twilight zone, he can hide his memory or his knowledge about the subject of the case. But if he will be in the twilight zone, he will lose his willpower and his self-preservation instinct so that he cannot reason, but he will disclose everything without evasiveness. Probably this is the most favorably effective if observed, but there are some objections in this method, and these are as follows. Number one, was the test performed by a skilled operator, technician, or physician? Was the dosage of the drugs administered necessary to produce desired result? Was there an appropriate amount of time consumed in the test? Was there certainty of result to determine truth from deception? Here, because the truth serum is done involuntarily, this result of this method is not admissible in the court of law. It is part of the fruit of the poisonous tree. But its application to criminal investigation is very useful. Let's move to the sixth one, the intoxication, wherein this method is employed by giving alcoholic or intoxicating beverages to the subject as the stimuli to obtain the truth. This time, the subject will be allowed to take alcoholic beverages to the intoxication level, because by that, the power to control the body is administered as the investigator begins propounding questioning. The desired state of the subject is the excitatory effect of the alcohol, or the state wherein he will lose his self-control for self-preservation so that he can give the information to the one questioning him. But it must be done not in excess, or else your subject will fall into sleeping. This time in the intoxication, the spirit of the alcohol is the instrument of the interrogator so that he can get the information needed in the investigation. But in most instances, what the subject uttered cannot be recalled when the effect of the alcohol disappear. Or usually, he will just refuse to admit whatever truth he gave during the questioning. The seventh one is the psychological stress evaluation. By this, we are analyzing the pattern of significant stress by means of psychological stress evaluation testing, or the PSE. This provides an accurate assessment of person's psychological set. Under this PSE, stress-related components of human voice are examined. Superimposed on the audible voice frequency are measured. Because the normal voluntary rate occurs 8 to 14 cycles per second. And these psychological tremors or microtremors are being examined and measured. Psychological tremors are seen in the voice mechanism appears to be controlled by the central nervous system. And in this examination, once the subject is questioned, the stress given to him or her induce fear, anxiety, guilt, and conflict facilitates detection. This conflict facilitates detection of the attempted deception during the interrogation. That is what we are measuring here, the changes in the voice, the tremors, so that we can see if the subject will attempt to deceive the interrogator. The eighth one is the brainwave fingerprinting. This is actually a game-changing science in deception detection because it detects the concealed information is stored in the brain forensic science, in the brain of the subject. This is among the forensic science updates or upgrades in the field of deception detection. Brainwave fingerprinting scientifically detects whether scientific information is stored in the brain by measuring the brain waves. The purpose of this examination is to detect whether a suspect or an individual has knowledge of privileged information that he or she may be concealing. This method is based on the theory. Okay, let's have now the ninth and the last, which is the most common in the criminology world, and that is the polygraph test examination. There is a theory in lying. This theory is based on once a person lies, there will be an emotion-evoking stimulus. Once the question is given or asked to him, the conscious mental effort on the part of a normally conditioned person will cause physical and physiological changes in the body. Usually, the common changes is the breathing pattern, the blood pressure, and the galvanic skin reflex, or the emotion and the electricity in the body of the subject. And those changes likewise are capable of being recorded if we will use an instrument. And that instrument is called polygraph. Some called it deceptograph, or some called them pneumogalvo-sphygmocardiogram, wherein it composed of pneumo, galvo, and sphygmo. And those three common instrument of detecting the physiological changes in the body are all incorporated into the device called polygraph. So far, these are the 9 common or well-known methods of deception detection. Hope it helps in having the overview on how they are being conducted. And if you want or if you have interest in this field, you can explore more and can study more in this field so that one day you might be an expert also. Thank you very much. God bless us all. Jesus saves, and to God be the glory.